to hand over to Janella Pereira. Janella, are you there?
Yes, I'm here. Thank you very much. Half a day, everybody. I'm just going to go ahead and begin by sharing my screen. Can you guys all see this?
Yep.
Yep, it's coming up.
All right. And I'm just going to go ahead and turn off my. All right. Half day and welcome, everybody. Thank you for having us at the Pacific Health Information Network. I'm honored to be here. Again, my name is Janella Carrera, and I'm the PIO for the Guam Department of Public Health and Social Services. Also presenting today is Vince Munoz. He's with Next Gen CIS. He's the founder. And then after that, we'll have Dr. Ramesh Raskar. He's the associate professor for MIT and also the founder of PathCheck Foundation. So what we're going to be talking about today is the Guam COVID Alert app, which was launched in September. And also some of the success that we've had in launching it, despite virtually no funding in being able to advertise it. So this is just one of the logos that we shared when we began sharing it with the community here in Guam. Just wanted to share that with you. This was designed by the governor's office in partnership with Public Health. So you can see the logo there, the governor's seal in Public Health. And this was actually templated, but we of course added some localized images here, of course, with Guam in there. And then this right here is the website, the guamcovidalert.guam.gov. And of course, with the logo, the exposure notification logo from Apple and Google, and of course, the PathCheck Foundation. So, when we started this project, we did seek the support of the government in asking for some funding. But understanding that there is a need in Guam to ensure that CARES Act funding and any other funding would be prioritized for the fight against COVID-19. We planned for Plan B, that in the event that we weren't given the kind of funding we needed, that we would work around that and launch a campaign that would be really just based on a grassroots effort. And so we went and reached out to the community. And so this is just one of the slides I wanted to share with you. When we did our presentation to the community, we encouraged adoption amongst membership and staff with companies and organizations. We created what's called a supporter toolkit. We created logos that they can share for their letterheads or email signatures, and I can share that with you later on. Digital badges that they can put on their website, social media, and I'll show that to you in a little bit. And then of course, we also did some social media boosting of adding your phone to the COVID fight. We encouraged internal competitions, which is something that we actually did within the government of Guam. And we also asked some companies if they can perhaps, do some internal articles in company newsletters about the Guam COVID Alert and other neat ideas to encourage the Guam COVID Alert app download. And I apologize, I didn't even explain what the Guam COVID Alert app, I think Lauro mentioned in his presentation, the Guam COVID Alert app is an exposure notification app. It's a digital contact tracing tool. And so when Guam took on this project, we wanted to augment our manual, our traditional contact tracing. We saw the need for it because here in Guam, our numbers were starting to increase. Our COVID-19 cases were starting to increase. And at one point, our ideal turnaround time from the point where you receive notice that you've been diagnosed as COVID-19 positive to the point that somebody from our contact tracing team makes contact with you is about 24 hours, 24 to 48, but we really try to reach 24 hours. And so our contact tracing team uh, was somewhat overwhelmed. And so it was looking more like 3 to 4 days before somebody from our contact tracing team or investigator would make that contact. And so we thought, contact tracing, digital contact tracing tool would really aid in bringing that gap a little bit closer, and also really help the people, um, you know, guide them in what to do should they receive that COVID positive diagnosis, um, and also an alert on their phone that they may have been possibly exposed to somebody who's had COVID-19, um, and let them know that, hey, at this point you would need to quarantine, for 14 days because you may have been exposed to somebody with COVID-19. Also, let them know that these are the places, the clinics that you can contact if you develop symptoms at a certain point. And at that, with that, that would help to minimize the spread of COVID-19 here in Guam. So when we launched in September, we got a lot of good coverage. So these are some of the stories. This is an article right here in the bottom left, and this is Dr. Ramesh Raskar. And we were fortunate enough for him to grace our press conference, and that's what you're seeing here is a screenshot of our Zoom press conference. And so Guam was actually, we are the first U.S. territory to launch the Guam COVID, an exposure notification app using PathCheck and Google Apple. So we got some really great coverage with our press conference. And so I just wanted to share with you that, through our press conference, we did get great coverage with that. I'm just going to stop sharing this for a second, and I'm going to take you to our website real quick, and I'm going to take you back here to explain what these 3 articles are in the top. So let me just stop that real quick, and then I'm going to share our website. Okay, so this is our website here, the Guam COVID Alert app website. So before we did our official launch, I was actually supposed to take you here first. So before we did our official launch, and as I mentioned, we didn't have a lot of funding. Actually, we had practically 0 funding to launch this app. What we did with our team, Vince, and we also had Monica Guzman with Galiti Group. We had a team from the governor's office to assist us. We had a team from the Guam Visitors Bureau. And then of course, here at the Department of Public Health and Social Services. And by the way, Monica and Vince, we had Shante Benitez, they're all volunteers. They volunteered their time because they were really passionate about, reducing the spread of COVID-19 in our community. We reached, we just used our connections, our business connections, our family connections, friends and family, word of mouth. And what we did, which I thought was really innovative, was we did a series of Zoom presentations. We reached out to civic organizations, through to faith-based organizations, to business communities, government organizations, schools, chambers of commerces, just you name it. We reached out to anyone and everyone under the sun, and we said, we have this neat digital contact tracing tool that we think you will be really interested in, that can really help reduce the spread of COVID-19 and help save lives. And we have a presentation coming up. Won't take any more than maybe 30 to an hour of your time. And we'd love to invite you and to check it out. So that's what we did for maybe a good month leading up to our press conference. So before we even had a press conference, we sort of built the momentum and got the community to start talking about the Guam COVID Alert app. And then we also launched the website before the Guam COVID Alert app. just to get some, some talk amongst the, within the community. So this is our website. And I'm just going to play a quick video just so you have an understanding of how the Guam COVID Alert app works. And let me just make sure that the screen share audio settings work as well. I think I forgot to check mark it. Okay. Oops.
Battling COVID-19 is an unprecedented global challenge. To get communities around the world back up and running as quickly and safely as possible, public health authorities are building smartphone apps to help with contact tracing. Contact tracing is one of the best ways to stop a virus from spreading. It can take thousands of disease investigators to alert everyone who's been in contact with people who've tested positive. But even if disease investigators do their jobs perfectly, alerting the people a COVID patient doesn't know or can't remember is incredibly difficult. Smartphone apps that public health authorities build can help people at risk of infection get notified much more quickly. But a contact tracing app works best when more people download it. And being asked to download an app without knowing how it will handle your personal information might cause people to worry about their privacy, and they may not feel safe participating. That's why engineers at Apple and Google have been working together to make public health technology that protects individual privacy, so that people never have to choose between their privacy and the health and safety of their community. You're probably wondering what that means and how that all works, and we're going to walk you through it in a second, but first let's be really clear about a couple things. First, apps using this system cannot track your location. And second, this system does not share your identity with Google, Apple, or other users. Here's how that works. For every phone that's opted in, our technology disguises your identity by generating a random sequence of numbers that change every few minutes. Then, using Bluetooth, anytime your phone detects another phone close by that's also opted in, the two exchange those random numbers. If in the future someone's positive for COVID-19, they can report that positive result in their app. Any phones that had exchanged random numbers in the last 14 days will receive a notification that they may have been exposed to COVID-19 without revealing their identity. Public health authorities can then help anyone at risk get testing and treatment. But it's up to all of us to help with contact tracing. Do your part and look for your public health authority app that uses this exposure notifications system. The more people who participate, the sooner we can beat COVID-19 and get our communities back on their feet.
Okay, so that's a video that was put together by Google and Apple to explain how the digital contact tracing app works. And then I'll also share with you some of the resources that we put together. So here is a supporter toolkit on our website. And if you, okay, one second. So here are just some of the social media assets that we encouraged our business partners, our partners with media, civic organizations, our government partners. And if you look here, we also translated it into the Chamorro language. So here is just some of them, which you can, of course, they're formatted to fit on Instagram, Facebook. There's even one that you can share as an email signature line. So let me just share with you here. That's my signature line, and I have it so that every time I send an email, you can see it. So this is our supporter toolkit. We have a section that, oh, okay, I lost it. We have a section that, I don't know why it's doing that, that shows our presentation. So this is the presentation that I was talking about that we gave to all the nonprofits and business organizations. So this is that presentation that I was telling you about. And we did this for about a decent month, maybe a little over a month. Okay, now I'm going to take you back to the PowerPoint real quick. Okay. Oops. Another neat thing that we also did here in Guam is we partnered with one of the local TV stations, and we did what was called a downloadathon. You know, you're used to hearing a telethon. What we did was called a downloadathon to drive adoption rates. You know, the gold standard for adoption rate is 60%. And I believe Ireland is number one in the world, and they hit 38%. So nobody's ever hit 60%. So we partnered with KOAM, which is a local television station. They also have a 6 o'clock news, nightly news, and then PBS, which is of course, you're familiar, I'm sure, with PBS. And then, of course, the Guam Visitors Bureau. To do a downloadathon. And so we encouraged downloads, and that actually drove up downloads for that one evening that we did it. And that was really neat. And another innovative thing that we also did was we used our WhatsApp channels. We just, you know, we send things through WhatsApp to our families and our friends, and that just went viral. So this is one of the things that we did through WhatsApp. We would just ask them, hey, you know, check out the Guam COVID Alert app. And a lot of times you send it through WhatsApp and you'll get it back tenfold. Same thing with the downloadathon. You send it through WhatsApp and you'll get it back as well. So that's another neat thing that we do here in Guam is, you know, sometimes rumors tend to spread faster on WhatsApp than any other social media platform. So we took advantage of WhatsApp as well. Let me take you back. So I'm going to take you back to this one slide here. So through all of our efforts, you know, with our grassroots efforts and just word of mouth, and also through earned media, after a while, you know, I think just through our innovative ways of trying to push the app and downloads, and even after that initial 3 weeks to a month of aggressive campaigning for the app, we saw the community starting to really trust in the app despite, you know, rumors and myths about personal privacy. Adoption started to increase, albeit slowly and gradually, to the point where we're now at about 33%. And I'm going to stop sharing here real quick, and I'm going to take you to our spreadsheet, which kind of shows you where we are. So here's the date starting from when we launched, which was September 10th. This kind of shows you our numbers. And here's Apple downloads, iOS downloads, Android downloads, and then daily downloads, and download percent to target, which is 60%. And that kind of shows you on a daily where we are. And so every single day, the numbers just gradually increase. And we are now at December, let's say the 10th, and we're at 33.73. So this kind of gives you a snapshot of where we're at. So we're at 33.73 of our goal. And as I mentioned, Ireland is at, I believe, 38%. The number of adult users for mobile phones in Guam is 122,000 users in Guam. And so 60% of that would be 73,200. So we've right now hit 33% of 60%. And, you know, with our team, we're very much optimistic with that number. And so, our understanding is that in the US, we're sitting comfortably, I think, at number one. I believe so. And I think Vince can probably speak to that a little bit more when he presents. And so because of that, I'll take you back to the PowerPoint. We've gotten recognition. So Technology Review, MIT Technology Review did a really neat story about Guam, recognize us as leading the way in the US. And that story actually was picked up by local media. So we have here PNC News picked up that story, as well as PDN picked up that story. And, I've actually gotten a lot of feedback as well from some of my colleagues, some of my former colleagues, telling me, wow, I'm really proud of your work. I'm proud of your team's work, that you guys are getting recognized for, what you guys have done with the Guam COVID Alert app. So, I think there's a lot to be said with this teamwork that we've done, and all the innovative ways that we found to make it work despite the traditional marketing that should be done in trying to promote anything really. And we, because of the urgent need and what we knew needed to be done, because we knew lives were at stake, our team really worked together. So just wanted to share all of that with you, how we were able to push this app despite the lack of funding, and the success that we found in doing that. So with that, I'm going to go ahead and turn it over to Vince Munoz. I'm just going to give you a little bit of a background about Vince. He's an accomplished software executive with over 30 years of experience in the software industry. He's the owner and principal of Next Generation LLC, also known as Next Gen Sys, which is a technology company specializing in software engineering services. Next Gen Sys is a PathCheck Alliance partner, and Vince has collaborated and worked on local and federal government and private sector projects, including the development and implementation of technology solutions such as web applications, mobile apps, geospatial technologies, and systems utilizing open source software. He's an engineer graduate of the University of Southern California. He received his PMBA from the University of Guam and is a director's fellow with the UOG Regional Center for Public Policy. So Vince, the floor is yours.
Hi. Okay, thank you, Janella. I'm going to try and go through this really briefly and quickly because I'd like to get to some of the things some outtakes we like out of this. So I'm just going to briefly outline some of the challenges we had, specifically when using exporter notification systems from Google and Apple, also known as GAIN. So many challenges are that GAIN does not permit us to capture GPS location, which for manual contact tracers can be a very useful piece of data. Secondly, the adoption period that Google, and it's true for most apps, is the first 2 weeks. So the outreach, as Janella described, was crucial to the success when utilizing the app. The Google Apple review process is very tedious and scrutinized for obvious reasons. And, when you're going through an app like this, there's so much to be said about concerns for privacy. And I do want to emphasize that that was paramount and non-negotiable by GAIN and PathCheck. Guam was extremely aggressive in the implementation of COVID Alert app. I think we were the 4th or 5th implementation in the US, just a few weeks after Virginia, which was the first GAIN implementation in the US. So, our mission was to try and adopt the 38% adoption rate. At the time, that was the Irish implementation, which was the highest in the world. We also wanted to promote that, our COVID Alert app was a form of empowerment. That is people could do something about reducing the spread. And, education played a big part of this. If you could go to the next slide, please. Yeah, I'm sorry. Yes, particularly with respect to privacy, in the US and many other locations and countries in the world, privacy was a major concern. Lastly, we emphasized that the COVID Alert app was a means of implementing quarantine management. That is, it helps to determine who needs to consider staying at home versus going to work. Our private sector community, actually in conjunction with the university, developed a testing plan. So, people could be tested and have some protocol so they could go back to work. And one of the elements of that whole methodology is to use our COVID Alert app. And so they're doing that now with many of the construction companies, which is probably one of the most challenging areas in trying to control the spread. There are lots of studies that talk about the challenges of construction, especially on Guam, where the military construction workers are H2 and bunked into these barracks where they're really closely and tight living quarters. If we could go to the next slide, please. Yes. So, some of the current work we are doing is an adoption study with the Institute of Technology and Global Health. This is a spin-off from PHIN. To the left, you can see some of their members. We're actually working with Julian Zolotrev. He's actually, I think, the youngest professor in the business school at Harvard. We're really excited about this study, and so many things we did in response to the pandemic was invented over this period. For everybody was, this was a whole new way of doing things, the new normal. So we think this study will really help us to understand and learn about many things regarding pandemic, from education and the use of technology, understanding of the services and other things that were out there. And if there's one thing we'd really like to see come out from this meeting today is it would be really great if we could conduct a Pacific-wide study. Hopefully this is something that we can follow up on. I know it's difficult. I mean, even in that original presentation, when they were talking about COVID alert apps, they didn't even show Guam's. And I attend so many webinars and I meet with the state leaders, and we're always asked about how we got the adoption rate up. We were one of the first to get implemented, and but it shows how little we share info. My wife, for example, did a recent report that's about to come out, part of the global study on indigenous women, and she covered the Pacific. And it's just amazing how little we get share and do these types of studies collectively. And we really need to, because we are very unique. Pacific Islands are not like any other location in the world. We're remote. There's an indigenous community typically, and there are just a lot of things I think that make us special. So it would be nice. I mean, when we first started this, we actually contacted SBC, but this shows you how difficult it is even for us that we don't have that channel of communication, because we had got no response back from them. If we could go to the next slide, please. And lastly, we really want to thank Dr. Thane from CDC, who provided so much leadership and support in our efforts. We never would have gotten where we were today. I mean, there are so many people part of this team, and PHIN, their constant emphasis on inclusiveness, open technology, privacy preserving, and just always being the lead. You know, when we originally did this, you know, they allowed us to participate, and we met with countries all over the world and saw different solutions and challenges using, you know, QR codes and GPS tracking. We were even part of that development effort. And it's important to understand that the PathCheck effort, you know, there's over 2,000 volunteers, tech companies from all over the world. So it was really an amazing effort. And, you know, with that, I'd like to pass this on to Ramesh, who is the founder of PathCheck, and have him talk about really where the movement is now.
And before Dr. Ramesh speaks, I'd like to just go ahead and give a little bit of a background on Dr. Ramesh Raskar. He's an associate professor at MIT Media Lab and founder of the PathCheck Foundation, the world's largest nonprofit open source foundation for COVID-19 software. His focus is on AI, privacy, and digital health. PathCheck Foundation is the world's largest nonprofit, privacy-preserving, open-source repo for COVID-19. The foundation helps nations and states with COVID-19 exposure notification and case management solutions, app, server, dashboard, and has contracts in multiple U.S. states and nations. He received the Lemelson Award in 2016, ACM SIGGRAPH Achievement Award in 2017, DARPA Young Faculty Award in 2009, Alfred P. Sloan Research Fellowship in 2009, and TR 100 Award from MIT Technology Review in 2004. He holds over 90 US patents. He has worked on special research projects at Google, Facebook to launch the first health innovation team, and Apple for privacy and health, and co-founded and advised several companies. So I'll turn it over to Dr. Ramesh Raskar.
Thank you, Janella, and thank you, Vince. First of all, congratulations to all of you for doing such a phenomenal job in the Pacific region. Let me tell you a little bit about the PathCheck Foundation and what's kind of the road ahead. I think, of course, we should be very proud of the work that's been done in Guam for contact tracing apps. And kind of the key message I want to get across is that apps are going to play a bigger and bigger role in dealing with pandemic. So you're welcome to join at pandemic.mit.edu or join our Slack channel, tiny.cc/pathcheck/slack. And I'll talk a little bit more about vaccines as well, because that's kind of the next, next opportunity. So as Vince and Janella already explained, PathCheck Foundation is an MIT spinoff. Very proud that there's an official app in 5 US states and territories and also in 3 nations. So, so Minnesota, Hawaii, of course, Guam, Puerto Rico, and you'll hear a few more coming up. And it has become the world's largest open source nonprofit project for COVID-19. But we also have a professional division that can work with any island or any state or any territory to deploy this in a matter of 2 weeks from scratch. And if you want to use the basic solution, it's free. But if you want any professional services on top of that, like servers and customization, then we have a professional team that can work with you. Again, this is a nonprofit, 501c3 nonprofit. So our goal is not revenue, but to help as many states and nations as we can. And pandemic response is always, no matter which country you go to, is always in a disarray because pandemics are different than a hurricane or earthquake, where a top-down solution, just setting up a command and control system, could work. But pandemics are about innocent people infecting other innocent people. So we have to empower the citizens to participate in the epidemiology. They have to participate in assisting the public healthcare systems. And that's where I think apps and smartphones can play a role to reduce the spread and restart the economy. And I think the very first question most people ask, like, hey, but these apps are like a GVs, are they going to work? 30%, 38% is great, but it's not for everyone. What about people who don't have smartphone? What if they have Bluetooth turned off? And there'll be 100 questions, and it can just lead to analysis paralysis. But as long as we treat the apps as just yet another tool, so that, some of you may have seen this very nice Swiss cheese diagram. for respiratory virus diseases, where you might use masks, and you might use contact tracing, and you might use surface cleaning, and each of them have imperfections, but multiple layers can improve success. So if you start with a virus on this side, and at least one of these layers would prevent any challenges from reaching to our population. But then there's also the Jenga aspect of it, because getting everything right is like playing the game of Jenga. So privacy can destroy trust. Efficacy in the systems can create challenges. If your communication is wrong, as Vince was talking about, your trust could be destroyed. If your workflow doesn't adapt quickly enough, that can have serious consequences. So there are all these competing challenges. It has a lot of consequences to how we can get going, and everything can come tumbling down. So as Vince mentioned, we're very proud of a really professional team that works with us, and about 200 professional volunteers who are active on a weekly basis, and over 2,000 that are active on a monthly basis. And it's not just about individual health or public health, but it's also about employers and tourism and services. I especially wanted to show this slide because if you look at the bottom half, public health is very concerned about monitoring and case management and spread analysis and so on. But if you look at the top half, which is how the users interface with the system, they need very specific services. So if we believe in empowering the individual so that they can help public health, we need to start providing the services. It becomes an experience that's very sticky, very engaging for them. So while public health might care about aggregate kind of performance and aggregate goals, individuals can get real-time, personalized, and even rare events. I went to that wedding and I want to get information if there was, a super spreader event there. So the people care about individual rare events. And how can you achieve all of this in an end-to-end privacy preserving solution that can provide analytics and insights? So I'm going to skip over some of the issues of contact tracing and talk a little bit more about vaccination. So, test, trace, and vaccinate. And as you know, the first vaccines are already being given out in UK and some other countries. And I hope, many of the, Pacific region would get that in the next few months. So are we ready to deal with that? How do we do prioritization? How do we deal with second dose and so on? And as you know, at least in the US, you'll have access to systems like, vaccine administration management system or vaccine adverse effects and adverse side effect monitoring systems. But they are going to solve, I call it the macro problems, at the system level. But the micro problems at the individual level are going to be very difficult to solve. Just this pandemic is so unique. And the fact that we have to vaccinate nearly everyone, is big. So the logistic challenges that are unknown are how are we getting with cold chain? How are we going to prioritize, who gets vaccinated first? How do we make sure there's equitable access? In terms of health outcomes, what's the durability of this vaccine? Is it 2 months? Is it 6 months? Is it 1 year? Even if it's 1 year, how do we make sure people are coming back? What are the side effects? Just today we heard that the Pfizer vaccine should not be given to people who have food allergies in UK. I mean, we're learning about this as we go. And every demographic is going to have its own issues because the mRNA vaccines are very dependent on your genes. So this is a very interesting challenge for us, and every demographic might actually respond to the vaccine in a unique way. Second dose reminder, because all these vaccines require 2 doses that are 21 or 28 days apart. Privacy of the user data, as Vince mentioned, and also some kind of a health passport or vaccine verification documentation that's privacy preserving. If you're somebody coming from Japan or US or another large country, they may not be willing to provide all their private information to a new tourist location. And you want to create something that's privacy preserving and not controlled by a single country. And then there's, of course, vaccine hesitancy, activism, and so on. So in that sense, think of this contact tracing apps or any app that, for the matter, as kind of a yet another tool in dealing with the next phase of the pandemic, which is dealing with vaccination. So let me show you a quick video of how this would look like.
Now we'll jump ahead in time to April. After this scare with the exposure notification, Alice is looking forward to a vaccine, but the state has to ration the vaccine because supplies are limited. In this example, the state eventually authorizes River College to distribute vaccines to its students. The university takes advantage of the high adoption of the state's app to help drive successful vaccination. Alice gets a notification on her phone that a vaccine is available.
Can you
when
see
she
my,
clicks through,
can you see the video?
Now we can.
Okay, good, excellent.
Yeah, now we can see it.
Okay, good, thank you.
The university takes advantage of the high adoption of the state's app to help drive successful vaccination. Alice gets a notification on her phone that a vaccine is available. When she clicks through, it takes her to the vaccination tools in the app. Alice can use the app to find a vaccination provider. And when she gets there, she can show that she's eligible for the vaccine. The provider asks Alice to use the app to track her doses. So she takes a quick scan of the QR code to record the first dose. The vaccine requires 2 doses. So after 29 days, the app notifies Alice to remind her she is due for a second dose. She scans this QR code and records it. Now she is done getting vaccinated. You can see her new home screen has changed. The buttons "Get Tested" and "Report Positive Results" are gone. Instead, she has the option to open the digital credential that shows she's been vaccinated. She can use this anytime she needs to demonstrate proof of a vaccine, for example, to get into a concert venue. The app also encourages her to keep recording her symptoms. This helps health authorities track the aggregate trends for vaccine adoption and effectiveness. All throughout the app, we've seen examples where users are sharing anonymous data. A digital pandemic response app like this is unique in its ability to aggregate the data about symptoms, testing, exposures, isolation, and vaccination. We think of this as a participatory, crowdsourced, real-time pandemic analysis system that can help the health authorities track the disease and coordinate a targeted response. The app lets everyone work together to stop COVID-19 without sacrificing privacy and liberty.
Excellent. So that kind of gives you an idea of what we can do using these apps that goes kind of beyond just traditional apps that would record or create diaries and so on. So these are very powerful mechanisms to do that. So we have a whole conference coming up on Friday in the US called Vaccines for All at MIT. In fact, the governor of Guam, she's one of the keynote speakers for this event, as well as leaders from Gavi and some of the top leaders in the world, folks from Biden's transition team and so on are here. So go to vaccine.mit.edu or let me know how you can do that. So I think with smartphone-based solutions will improve speed of vaccination, improve vaccine efficacy and safety, and ensure inclusiveness so that underprivileged are not the last ones to get the vaccination or subjected to unsafe or ineffective vaccines. So we think this is really an era of a citizen-centric epidemiology. We should continue to do these top-down solutions, but also think about kind of a ways for health systems. It's a kind of a traffic navigation app that's privacy preserving, can deal with vulnerable groups. It's nonprofit, it's open source, it can do testing, vaccines, and other fast emerging health threats as well. So I invite you to join at pandemic.mit.edu on the MIT side or pathcheck.org on the pathcheck side. And I hope that many islands and many nations will use this open source nonprofit platform to launch the app in a matter of days. And we can help you, or WINS can help you get there with very limited resources required, so that the population is ready with an app in their pocket that's completely privacy preserving, and they become actually a participant. They become stakeholders in helping public health in improving the ecosystem, and they work together. Thank you.
Thank you, Ramesh, very much for that, and thank you for all from Guam and your presentation. Now, I realise it's been a bit of a marathon today, and our colleagues from CNMI have had to leave us. So in terms of questions, I have 2 questions, I think, for Guam, and if you can bear with us, so we'll persevere with that. Question I have is the Guam contact tracing app linked to any government source or public health system? Does it depend on the individual taking action to isolate or get tested?
I think Vince can probably answer that.
I'm sorry, could you repeat the question?
Sure. So the question is the Guam contact tracing app linked to any government source or public health system? Does it depend on the individual taking action to isolate or get tested?
No, it's not linked. The government is totally free on how it interacts with it, but it does require, because of the way the GAIN system works, is that when a person does test positive, they have to voluntarily opt in to share their key codes with the rest of the community that has downloaded the app. I hope that answers that question.
Okay, thank you. And one question from Katri. The vaccines for all recorded. Time could be an issue for us. Not quite sure, Katri, whether you want to elaborate on that question.
Yes, sure. So I would be very interested about this. We are looking as a joint IMT for the COVID-19 response, regional level, the potential tools to facilitate the COVID-19 vaccination data management. And therefore, I would be very much interested to participate on that webinar, but I don't know how it translates for the time difference between Pacific and the United States.
Yeah, so the talks will be recorded and posted on the MIT YouTube channel. So you should have access to them after the event. But I just posted a link to our Slack channel, tiny.cc/PathCheck Slack. And that will allow you to also stay in touch with the wider community of how the app is developed. As Vince said, this is a very open community. In fact, Vince was one of the earliest contributors, even before I believe he decided to do this for Guam as just an individual. He joined the community, started contributing, and his team, and eventually become a Guam app in addition to other apps. So, but the work that Vince and team has done is actually being used by the rest of the world as well for free. And I think the same thing here. We welcome you to the Slack channel and post these questions and say, hey, these are the kind of vaccination plans you have or contact tracing plans you have, and what can change. It's just a very vibrant community. So we welcome you to join that.
Hey, thank you.
Thank you very much.
And I also posted the slides from my talk, which has the videos embedded in it. So if you want to use them.
Thank you. So yes, we will make a recording of this webinar available. We'll send it out through the same circulation list that we used to invite you in the first place. And we also have we're pleased to say that we have launched a PHIN website. It's only an interim website, but we'll provide a link to that as well when we send out the link to the recording, and whether we will be able to embed that in the website as well. It's fingers crossed. So unless there's anything else anybody would like to contribute, I think we've probably all done extremely well today, and I'd like to thank all the presenters and all the people who have been involved in putting this together, and hope that you can join us again in the new year when we the PHIN webinar program will come to you again with new and exciting topics, and hope to see you all then also. So thank you very much.